Now, many people with arthritis say that cold weather worsens their symptoms. So what can be done to help?
Yes, here to answer all of our questions, we have Mr. Adeel Memon. Adeel, you've been very, very busy since you came in here today. Of course, you're with the Maura Private Hospital. Maura had a quick chat with you and Brendan.
We were all asking, because of course he's an consultant orthopaedic surgeon, so we were checking.
You've been very, very busy since you came in.
I know, four consults so far.
4 consults out, social distancing consults in the green room, moving our hands with our issues, with our things. I suppose arthritis is such...
We've all heard about it for so long.
And it seems to be so prevalent that most of us will get it in this country. First, I want to ask you, does where you live, in the sense of a damp climate, affect arthritis?
Not necessarily, no. There is no scientific basis to say that weather affects arthritis, okay? A lot of people would, when they come into the clinic to us, they will feel that the pain gets worse in the cold weather. And I think it's probably multifactorial, that as the weather gets cold, you tend to stay indoors, you don't go out, you don't move your joints as much. And that overall, you know, kind of your level of activity is reduced, and that kind of contributes towards the pain that you're getting, you know. So I'm not sure, like there's no scientific data would suggest that, you know, a cold weather would actually affect arthritis.
Okay, because that's a good one, because I think I'd have probably heard that probably 30, 40 years ago.
Yes.
But Adeel, what is arthritis exactly?
Sometimes the arthritis is it's a general term described like, you know, for any joint pain. Now, arthritis as a disease, like there are many different types of arthritis. The most common one that we will see is what we call the degenerative type, where your lining of the joint gets, you know, degenerative damage.
Is that just wear and tear, ordinary life?
Yeah. But likewise, there are different types of arthritis which are more inflammatory type arthritis, like of rheumatoid arthritis or other autoimmune diseases which can also cause arthritis. So in general terms, sometimes it's not appropriate to just call every pain in the joint as arthritis, because, you know, there are different things that can cause it.
When we talk about arthritis, you're talking about the joints. Are you talking about, say, your elbows or your knees? Is arthritis always in the joints or in the bones?
Yeah, so when we talk about arthritis, we're talking about the joint itself. Okay? There are certain tendons that crisscross the joint, they're attached very near to the joint, and that can also become painful, but that is not called arthritis. You know?
Yeah, and who is mostly affected by this?
It depends. So the common arthritis, what we call the osteoarthritis, tends to affect the older people, because with age, the joints are degenerative, you know, lifetime of your work, your job, and, you know, wear and tear and things like that. On the contrary, if you have inflammatory type arthritis, it can affect younger people, and it's obviously less common, but you know, the distribution depends upon the type of arthritis you're looking at.
Okay, let's talk about inflammatory type of arthritis. Is that rheumatoid arthritis? Is that one of them?
It's the rheumatoid is one of those types, and likewise there are other types of inflammatory arthritis which will affect the body in a similar way, but not exactly the way the rheumatoid would. But rheumatoid arthritis is one of the types of the inflammatory arthritis. And likewise, the other types are like psoriatic arthritis. People who have psoriasis sometimes get arthritis. And there is gout-related arthritis. There are other, there are certain people who have autoimmune diseases that can cause arthritis. They're all different subtypes of what we call the inflammatory.
Adeel, if there's somebody at home watching this now, if they're feeling some kind of tingling or some kind of pain, and they may think that it's arthritis, what will they be feeling exactly? And where?
So the commonest symptoms of arthritis will be pain and stiffness in the joint, any joint. Let's just say knee, say for example.
No, that's just not a one-off pain. This is happening every day, is it?
Yeah, so it's not a one-off pain, no. But usually what happens, like somebody, say for example, in their 50s or 60s, let's say for example, had never had any pain before. One day they have a pain, the pain gets better, but then comes back. So typically arthritis pain will come and go, and it increases with the intensity will increase as as the time progresses. So by the time they come and see us, they would have had the symptoms for 6 months to a year, you know, that they have been having intermittent pain. So that's very typical of arthritis.
What can you do then when it comes to that point that somebody comes to see you? What type of medications, or we've heard of fish oils. What is your view on that?
So it depends upon the stage of their disease and the kind of activity they do and they want to do. So the treatment is more or less kind of individualized. And some people with early arthritis will do very well with a course of physiotherapy to strengthen the muscles crossing their joint. So if we talk about the knee, say for example, the patients get great benefit if they build their quads muscles when they're in their early stage of arthritis. And even in the later stage, even in somebody who we plan to do a knee replacement, we always put them through a course of prehabilitation before we do the knee replacement. And the purpose of that is that the recovery is a lot quicker, maybe not a lot quicker, but a lot better if they have a good muscle to start with, okay? And because when the arthritis happens, it takes away the cartilage lining of the joint, and there is no way to regenerate it.
Yeah.
But the purpose of the exercises to build up your muscle is to provide enough strength in the joint to make up for the lost cartilage you have.
And I'd imagine, say, Adeel, if you were overweight then, or if you were carrying a lot of weight, that you're putting more pressure on the joints, and that's going to have an effect as well.
Absolutely. It's one of the most, shall we say, important modifiable risk factors. That's something that you can modify, you know. And I see a lot of patients in my clinic who would be on a higher weight side, and they come back after, you know, if you see them back in 6 months, if they have lost weight, they say, look, I don't need the operation anymore.
That's quite amazing, isn't it, that you can change. So exercise and keeping fit is really important. What about arthritis? Is it hereditary?
No, it's not really hereditary.
Okay.
Like certain types of inflammatory arthritis, they will have a positive family history, okay? But usually, you know, it will be rare for arthritis to be hereditary. You know.
Now, can food affect it? Whatever the types of food you're eating, can that affect your arthritis? Can it kind of set it off in any way, shape, or form?
Not really.
No, because the reason why I asked that, because years ago we were always told that rhubarb was great for arthritis for some reason. Now, these are myths we'd have heard down through the years.
Yeah, I mean, people who have gout, say for example, there are certain types of food and drink that if they would take, that will increase the risk of getting a gout. That's different. But a degenerative arthritis is not really affected by the food. Yes, it is affected by how much you eat.
Okay.
That's you know,
that's the other side of it.
You have
Obviously, if you have arthritis, are you more predisposed to falling and slipping, and can that be an issue?
It's an issue because when you have arthritis, naturally speaking, you tend to not use that joint as much. So if the knee is affected, say for example, you're not walking as much, you're not moving the knee as much, and you lose tone in your muscles, you lose the feedback that you would normally get from the joint in your brain, okay? So that sometimes can increase the risk of falls. But so it's kind of an indirect way the arthritis might predispose you to the falls.
What about quickly fish oils? I'm just wondering, because a lot of people link fish oils to, you know, good bones and good joints and flexibility. Do you believe in taking supplements like fish oils?
I personally don't have much experience to say yes or no in terms of what, you know, what's the best behind fish oil, but that is something maybe that, you know, I don't practice alternative medicine.
Of course, as a surgeon.
Ways, I suppose.
But I suppose, again, anything that kind of lubricates the joints maybe is a good thing. Thank you so much for joining us.
No
really
problem.
great for joining us. Of course, if you have any health concerns, always consult your GP. And if you want more information on what we discussed today and on arthritis in general, you can head over to hse.ie.